So a teratogen is just any external agent, anything external that harms the developing baby. And so we're going to talk about a range of those, from recreational drugs, prescription drugs, diseases, genetic factors. And remember, genetics is not just things that are inheritable. Inheritable means my mom had it or my dad had it and it got passed down to me. Genetic can also mean a mutation on a gene. So that means I can have a genetic disease, but that doesn't mean that my mom or my dad had it. Okay, so and what I want you to think about when we're going through all of these is which of these are preventable. So which of these are kind of like useless damage to the baby because we could have prevented it and it was out of ignorance or out of selfishness chose not to. And then how do each of these elements affect motor development? And sometimes it may not be obvious, the effect on motor development. Sometimes they're going to talk about intellectual disability. Sometimes they're going to talk about growth. But you should be able to make those connections and figure out, how does growth affect motor development? If they're a small child, how would that affect their motor development? If they have a low IQ, how does that affect their motor development? So be able to make those connections as you're learning about these different teratogens. So for recreational drugs, and we're not going to talk about every single thing that could ever come into the life of a child. We're just going to hit a few highlights. But starting with alcohol, and I think it's definitely important to talk about this because we've had celebrities and promoting safe amounts of alcohol, and there's no research that says that there's a safe amount of alcohol during pregnancy. So even if you aren't sure if you're pregnant, but you're trying to be pregnant, or if you're not preventing pregnancy, you should be not using alcohol because, like I said, it's really early on in development when teratogens are the most damaging, and you may not even know you're pregnant during that time. And so you want to just be better safe than sorry. If you think you could be pregnant, don't drink. The main outcome of alcohol use is a disease called fetal alcohol syndrome, and it is an intellectual disability. So that's the main thing, is that they're going to have a low IQ, so comprehension is going to be difficult. And then on top of that, they're going to have lower growth rates, and carrying to term may be difficult as well. Okay, so no safe amount of drinks when you're pregnant. For cocaine, just one use of cocaine can lead to birth defects. So that's important for you to remember. It's not, just like alcohol, no drink is safe, no usage of cocaine or any recreational drug is safe during pregnancy. And the main outcomes for the baby after cocaine use are you're highly likely to miscarry or even have the baby prematurely, which would mean that the baby is very small already. And then you notice that they have poor sucking reflexes. Well, the sucking reflex is what helps the baby eat. So if the baby's already small and now he's not able to eat, well, no wonder he's irritable, right? He's starving, okay, not only of food, but also if you're using cocaine while you're pregnant, then the child develops an addiction to that substance as well. And so they come out wanting the cocaine still. So irritable, poor attention, poor reflexes, low birth weight. Tobacco use, this would be cigarettes, especially also chewing tobacco. It increases the risk of it's a low birth weight, premature birth, and miscarriage, or even having the baby born still. And also after the baby is born, it increases the risk of sudden infant death syndrome. And so definitely not something you want to take a chance with, right? Keep off the tobacco while you're pregnant. And then cannabis, the last recreational drug we're going to talk about. So this is interesting because a lot of the states are developing where marijuana is starting to become legal now. So it's not an illegal drug anymore. But there's still not a lot of research. There's definitely not any research that says that it's safe during pregnancy. And so your book stance is just that it's not recommended, that you'd rather err on the side of caution. You'd hate to use one time and then impact your child's life for the rest of their life, right? You you affect their development in maybe even IQ or motor skills, and that carries with them forever. So it's not worth it. So we're thinking about recreational drugs, but also prescriptive drugs and non-prescriptive drugs, which we also just get into this idea of thinking that they're safe, can also be damaging to the baby. And so the FDA has ratings on the safety of different medications to the baby. So if you think you're pregnant and your doctor gives you a prescription, then you want to call and talk to them about if you can continue that medicine or whether you need to switch to a generic or a different version of that medicine. For example, and this is an over-the-counter drug example, but doctors recommend that you use acetaminophen instead of aspirin while you're pregnant. So you would avoid aspirin during that time. So you can call and get those ratings and find out if you need to switch drugs, or sometimes you even have to go off the drug while you're pregnant. And you can look at, there's a table that gives you examples of certain prescription and non-prescriptive drugs and their impact on the baby. But for the most part, whatever part that the baby is developing the fastest, so if it's at a point where their brain is highly developing, then that's what's going to be impacted by your use of prescription and non-prescriptive drugs. So you definitely want to be careful about that and be informed.